All right, let's do some drug calcs. Again, this is not for actual use purposes. Follow your protocol, whatever your medical director says, because he is an actual doctor and you only act on behalf of a doctor. And honestly, you shouldn't be doing any of this anyway if you're not a paramedic. Anyway. Diphenhydramine. This is Benadryl. We use this for allergic reaction, anaphylaxis, dystonic reactions from antipsychotic drugs, dystonic. So something that is not how it's supposed to be, tonic, clonic, post, something that happens after, maybe, after you give a drug that is antipsychotic. 25 to 50 milligrams intramuscular or IV. Check on milligram to kilograms per dose. If they are larger, they probably take a higher dose. This is an antihistamine as well. This is going to prevent those basophils from blowing up other cells with histamines. Side effects, drowsiness, contraindicated in patients with asthma history. We don't want to, for some reason, if they have asthma, no. PEDS dose, 1 milligram per kilogram IV or IM, maxed out at 50. All right, we have dopamine, inotropin, dopamine, ENO. What is ENO? ENO is like root. I think it is the contractibility, I believe, of the heart. Dopamine, hypotension. Hypo meaning below, tension, we know what tension is. Cardiogenic shock, neurogenic shock, septic. Am I recording? I am recording. Neurogenic shock, septic shock, bradycardia, refractory to atropine. IV drip, usually 800 milligrams in 500 milliliters D5W, or 400 milligrams in 250 mLs D5W in 1600 microliters per milliliter. That is typically what we're going to see for the most part, 250 D5W. 220 micrograms per kilogram per minute. That is our drip. Titrate the patient's response. Side effects, they might have tachycardia. They might have hypotension. They might have hypertension. Could have PVCs, preventricular contractions, tissue necrosis if infiltrated, as with many drugs, and PEDS dose 2 to 20 instead of just automatically, well, it's 2 to 20 for all of them. So typically we'll give 10 because that's easy math. So again, IV drip, 800 milligrams in 500 milliliters, D5W, or 400 milligrams for 1600 microliters per milliliter in 250. Trying to do that math in my head real quick. Per milliliter. Yeah, cool. Epinephrine, adrenaline, asthma, allergic reactions, anaphylaxis, asystole, PEA, VFib, or VTAC. We could have, without a pulse, epinephrine drip for bradycardia. So you'll have 1 in 1,000 subcutaneous and IM. This is for asthma, allergic reactions, 0.3 to 0.5 milligram or milliliter. Then we have 1 in 10,000. This is IV for anaphylaxis with hypotension, 0.3, 0.5 milligram, and 3 to 5 milliliter. 1 in 10,000 IV for cardiac arrest, 1 milligram to 3 to 5 per minute. So think about, we're getting less invasive and more aggressive as the symptoms get worse, right? Anaphylaxis and cardiogenic shock, obviously you're dying, you're dead, so that we are maxed out. But allergic reaction, not so much in asthma. So we're going to do 1 in 1,000 for asthma and allergic, 1 in 10,000 for the rest. Epinephrine pen, we have auto injection, that's easy, 0.3 for adults, and peds are 0.15 in their PD pen. IM, lateral thighs, typically where you're going to go. Epinephrine drip, if we're giving that to boost vasodilation, what is it? Drip for bradycardia, epinephrine drip for bradycardia. 2 to 10 micrograms per minute. Alpha and beta stimulator, bronchodilator. So it is beta 1. Yeah, beta 1, because beta 1 is the heart, and then alpha for arteries, and I guess bronchodilator, so it's going to do that as well. These are the 2 receptors that epinephrine performs on the body. Positive, inotropic, again, squeezing more, and chronotropic, it's going to increase rate. Chronotropic, heart's beating faster, rate. Sympathetic agonist, it's going to activate on the sympathetic nervous system. It is acting upon the sympathetic nervous system. So it is increasing your heart rate, is probably dilating your pupils. SVR is going to increase. God, I forgot what that is off the top of my head. There's so many acronyms. Systematic vascular resistance, I believe. Side effects, hypertension, increase. Tachycardia, myocardial ischemia. So they could have pain in the heart tissue's getting inflamed or ischemic. Dilated pupils, there we go. Palpitations, pay close attention to the heart rate. Above 120 could be a contraindicator. We don't want to pump it too fast. Fentanyl and sublimase. So there is fentanyl, and then what counteracts it? Sublimase, which we do not give. No, not sublimase. Flutamazone, something like that. Counteracts fentanyl. So it's very potent narcotic, obviously, for respiratory depression and central nervous system depression is what it can cause. Dose 50 to 100 micrograms slowly, IV 1 to 2 minutes. You could give it intranasally and you could give it intramuscularly. Peds, we're only doing 1 to 2 micrograms. We are titrating that down for babies. Intraosseous if necessary as well. So I guess you can go that way. Here we go. What is this? Nope, that's not it. Furosemide, Lasix, furosemide. Remember, ides are good for edema and fluid overload. So that's important for the test. Anything that rhymes or has that suffix at the end of it, it's going to typically be the same type of medication. If you've never heard of it before, but it ends with an ide, we know that it's for diuretics. Loop diuretic blocks the reabsorption of sodium and chlorine with water in ascending loop of Henle. Ascending loop of Henle. I've seen that before, once before. 0.5 milligram to 1 milligram per kilogram IV slowly IM. So if I weigh 60 kilograms, I want a maxed out dose for being generous. 60 milligrams, slow, intramuscular. Side effects, hypokalemia. So I'm going to drop in my potassium. Hypomagnesemia. I'm going to drop in my magnesium. Tinnitus, I might hear ringing, hearing loss. Hypotension. Interesting. Peds dose, 1 milligram per kilogram, usually max dose of 20 milligrams. You know, I think I've been hypokalemia, so I need potassium sometimes. I need more bananas. Interesting. Hypoglycemia, glucagon. Oh, interested? No. Glucagon does a lot of things, but it's very short right here. Okay, causes the liver to release stored glycogen to raise your glucose level. Produced in the alpha cells of the islet of Langerhans. Given IM, intramuscular, naturally produced in the pancreas. That was a question. That was a test question. Interesting. Damn. I keep seeing these and I'm like, if I knew 3 of these, I wouldn't have to be here and do this anymore. Dose 0.5 to 1 milligram IM, naturally produced in the pancreas. But it affects your liver. Lidocaine, xylocaine, cane, remember the cane, PVCs, VTAC, ventricle fibrillation, even though lidocaine has multiple uses. 1 to 1.5 milligram kilogram IV bolus, max dose 3 milligrams per kilogram. Not going to be too crazy with it. May follow with a drip 2 gram meter, I never know what 2 GM means. 500 milliliters or other mixtures at 1 to 4 milligrams per minute. Reduce infusion dose by 50% in patients over 70 years old. We're going to be very sparing there. Elder Gray. May be given down the endotracheal tube. And antidysrhythmic. PVCs, VTAC, VFib, those are all dysrhythmias. Do not use for PVCs and bradycardia. We're going to use atropine. If it's slow, we need to atropine it up. But otherwise, lidocaine. Xylocaine. Side effects could be lidocaine toxicity, central nervous system symptoms such as irritability, paresthesia. I need to look that up. Decreased level of consciousness, muscle twitching, tremors, confusion, ringing in the ears. Late effects is seizures. Peds, 1 milligram per kilogram. And let's stop there.